name is Kelsey. I'm going to perform my newborn baby assessment. I've already checked with the mother to ensure that I can perform the assessment on this baby. She has agreed, and I have already performed my hand hygiene. I'm going to first start by checking the baby's identification bracelet for his name and his date of birth to make sure it's the correct baby, and it is. I'm going to first start by checking for the vital signs. I can check the temperature under the armpit. Normal range for baby's temperature is 97.6 to 99.0. I can also ensure that the respirations are within normal limits of 30 to 60 per minute. And I'm also checking the heart rate, which normal is 100 to 160. I'm going to cover him back up, and I'm going to remove his hat to feel his head. I'm checking for the molding that has occurred during birth. I'm looking at the anterior fontanelle and the posterior fontanelle, and I'm also feeling the suture lines to make sure that there isn't too much overlapping. And I'm also looking for any caput fixodenum, which does not cross the suture line, or any cephalohematoma, which does have the possibility of crossing the suture line. I'm going to cover the baby back up to keep him warm. And then I'm going to move down and check his ears. I'm going to fold the ear in half and make sure that it springs back. That indicates that the baby was born at term. And I'm also making sure that the ears are at the midline with the eyes and that they're not too low set, which could indicate mental retardation. I'm looking at the eyes to make sure that they are symmetrical and that there's no subconjunctival hemorrhage. And I'm also looking at the epicanthal fold to see if it's present or absent. As babies are present. Usually babies that are Asian or that have Down syndrome could not have an epicanthal fold. I'm also going to check the patency of the baby's nose by occluding one side and feeling the airflow, and then occluding the other side and feeling the airflow. I'm going to put my gloves on and check the baby's mouth. I'm going to feel inside the baby's mouth to ensure that the soft palate is closed, and I'm also going to be checking for the suck reflex. I can also tap the baby's cheek right here, and the baby should turn his head towards my finger tapping. That's the rooting reflex. I'm going to move down and I'm going to feel the baby's neck to check for any masses or abnormalities. And then I am going to listen to the breast sounds bilaterally with my stethoscope above the nipple line on each side. And I can also check for heart sounds between the third and fourth intercostal space. The baby does not appear to have any respiratory distress. I can note that by there's no nasal flaring, no grunting, no signs of apnea, and no retractions. I'm also at this time going to look for any signs and symptoms of jaundice. I can look at the forehead, the sclera of the eyes, the chest, the abdomen, as well as the inner thigh. My baby does not have any jaundice present at this time. I'm also going to look at the abdomen of the infant to check for any masses or abnormalities. And I'm also going to listen to bowel sounds in all 4 quadrants to make sure bowel sounds are present and active. I'm also going to note the appearance of the umbilical cord, and I am able to clean it with an alcohol swab if necessary. I'm also looking at the baby's arms. I can check his reflexes by pulling them inward and then relaxing them, and they should spring back up by his face. I can also check the creases in the hands to ensure that they are present in the transverse position, and a single crease could indicate Down syndrome. I'm also going to check the palmar grasp at this time. I put my hand right here and he will grasp around my finger. I can also check the startle reflex by clapping my hands, and his arms should go out. And I can also at this time check the baby's genitalia. This baby is male, and I am checking to see if there's a foreskin present or if he has been circumcised. If he has been circumcised, I'm going to check the appearance of the circumcision to make sure that there's no signs and symptoms of infection present. And also I'm going to be checking that the urinary meatus is at the tip of the penis and not at the top or the bottom. I am also checking the scrotal sac to look at the rugae to see if there's rugae present. And I'm also going to ensure that the testicles have descended and are not up in the inguinal canal at this time. If the baby is female, I'm just going to ensure that the labia majora extend over the labia minora. And I'm going to cover him back up and fold the diaper over to not irritate the umbilical cord. I'm also going to move down to the feet and check the Babinski reflex by tracing a J up the lateral side of the foot and across the toes to check for fanning. And then I'm also going to roll the baby over just like this. Check to make sure that the spine is aligned straight and there's no curvatures noted. I'm also looking for dimpling around the sacral area and making sure that the spine is closed and noting if there's any tufts of hair to rule out spina bifida. And I'm also going to look at the hip alignment to make sure that there are no dislocations of the hips, which they look unilateral at this time. I'm also going to turn him over. I'm going to cover him back up, and I'm also going to discuss with the mother the bowel and bladder habits to make sure that the baby is voiding appropriately, which should be every 1 to 2 hour diaper changes, and that he's had a bowel movement within the first 24 hours. And then I'm also going to talk with the mother on the feeding schedule to make sure that the baby is feeding about every 2 to 3 hours.